down construction going on downstairs to the health department. So that was kind of nice. I was like, oh, something that I actually am excited to hear about. But yeah, some of the stuff it's like,
Oh, I would take you.
I did not make it to the county council meeting though last month because it was my 20th wedding anniversary and my husband was not gonna
You wouldn't pick the county council over your
No,
husband?
it was like between that and the
Good
budget
move.
stuff, I was like, yeah, I'm gonna miss that 'cause-
I just, the budget stuff, just like, at some point I just like black out.
oh, I went, I think we went last, yeah, I've been traumatized.
I mean,
It's just,
Like the second January of the year, would do like the budget. And it would be funny because we would be walking in, it's the budget one, it's the budget one.
yeah, everyone wants to get
That
out.
and first communion. Like, unless it's your kid, you don't want to hear.
No, the budget is, I mean, it's like stressful. It's like, I don't know if it's just the energy that's going on during.
I just don't know it, and it's hard for me to like get embroiled if I don't understand.
Xanax.
The budget
You know,
process is
I told the practice managers.
Yeah.
Yeah.
You understand
Yes.
it and know it, you've got 2 feet up on everybody else.
They can book my recommendation.
But
I will never go to Central School.
it's a lot. Let's just leave it at that. When they're doing the,
Somebody
for the
in
county,
someone
I just
shoving
like,
stations.
with all the judges and all that.
it's a lot.
They
It's,
don't care if you. I don't care how difficult.
okay.
I'm gonna give them
Yeah, you're
to
right.
directly.
I know, trust me. My front office knows.
All right, I believe we're at 5:30. If we can all stand for the Pledge of Allegiance. I pledge allegiance
to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
All right. Well, welcome everybody. Thank you for joining us. I am going to switch around a couple things on the agenda, if we don't mind. I will start with introducing and announcing Dr. Kim Brunt, who has completed our group of 7, and we're excited to have you here. And if you would like to take a couple seconds to introduce yourself.
Well, thank you. I'm excited to be here, and I look forward to serving with you all. As Dr. Boxer said, my name is Kim Brunt. I'm a licensed clinical psychologist. I work at a private practice called Anxiety and STD Behavioral Health Center. We have an office in Chesterton, Indiana. I am also a clinical associate professor of psychology at Purdue University Northwest. And I teach a number of different psychology courses. I am the internship coordinator for the Westville campus, and I also do research in the Scholarship of Teaching and Learning. And my husband and I have lived in Porter County for over 30 years. And again, I'm really happy to be here and excited to serve the community. Thank you.
Thank you. We're really excited to have you on board. So then I'll move to the minutes. If we can have a motion to approve the minutes.
I move we approve the minutes as presented.
Thank you. Ms. Lemon, a second? Patrick?
Okay, Dr. Bossom,
Yes?
Dr. Brunt. Yes. Dr. Fleming,
Yes.
Robin,
Yes.
Kathy,
Yes.
Dr. Osan,
Yes.
Terry.
Yes.
All
All
right.
right, thank you.
Thank you. Motion approved. So just some housekeeping business. So Carrie's going to get to this, but the Pierce Group is going to join us at our regularly scheduled December meeting to give our health needs assessment for the county. So with that being said, I'm going to cancel the extra meeting that we were going to have for planning purposes at the end of November in anticipation for that information. And then our regular meeting will be December 5th. And then after that, we will be presenting that information at the commissioners' meeting the following week. And then I thought we can just, sit on all of that information and get through the holidays and then reconvene back in 2024 and hit the ground running with our planning going forward. That being said, so we typically have our meetings the first Tuesday of every month. However, for January, the first Tuesday is the 2nd, which falls into a lot of people's holiday plans, which is understandable. So we were hoping then to move the meeting back 1 week to January 9th so we can all be back from holiday and get back on track on that day. So we don't know exactly yet the location. We have to get that squared away, but January 9th. So December 5th, January 9th, and then hopefully back on track to the first day of every month. And I think that's it for me. Board Attorney.
Other than working with the staff on issues of implementation of a lot of new parameters and a lot of new responsibilities, and working with Dan, I told Dan the other day if we didn't have the plate we have right now, his issues would be paramount and on the top of the list, because he's facing significant and substantial changes to how he does business as the result of the wisdom of our state legislature. But he's had to take a back seat to the other issues, but he and I have been meeting, and we're beginning to formulate a plan here that will facilitate us keeping as much ability as we can under the new statute to implement a regulatory scheme over Dan's area of expertise. But other than that, I don't have anything to offer.
Very good. Our claims and receipts should have been reviewed in email and should have been passed along to sign. Need a motion to approve?
Yes,
Yes,
you need
right.
a motion.
So if we can entertain a motion to approve those?
Could I
Yeah.
ask a question?
Of course you may.
I noticed the rental for the Expo Center was like $307,000. Is that FEMA storage there?
Yes,
Did we talk about that last meeting?
I believe, I remember hearing about it, but I don't remember the details.
Oh, I apologize. So it's not FEMA storage. I apologize. I don't want. So that was the monies that they lost out on during the time that we were utilizing the location for the testing and the. So we were
Reimbursement.
able to apply to FEMA for reimbursement for those funds, and we were given reimbursement for the equipment and rental locations and places like that that we used, and the $307,000 of that was for the expo.
Okay. I forgot.
Thank you.
I move we accept the.
Any second?
Second.
Awesome,
Okay.
thank you.
Dr. Bossel,
Yes.
Dr. Brunt,
Yes.
Dr. Fleming,
Yes.
Robin,
Yes.
Kathy,
Yes.
Dr. Osan,
Yes.
Terry.
Yes.
Thank you, everybody.
Thank you. All right, so we'll move on to our reports of committee staff and health officer. In your choosing, order of choosing.
All right, so I wanted to, today at the commissioners meeting, the architecture firm that, is, we had gotten some ARP funds awarded to us to do the expansion and remodel of the health department. And so we are very excited to be moving, along with that. And so I wanted to share with you, this is the presentation that the architect did to the commissioners this afternoon. All right.
Figure. Why I turned around in front of me.
I just have to scroll, I'm so sorry. Okay,
Not a
so
huge-
there are, the 4 different areas that are in play here. So the very first thing that they are doing is they are moving voters registration to 157 Franklin. So if you guys are familiar, that's the old, the Casa del Mar. There was a restaurant down there. So they are moving to that location. So that location build out is, I believe, complete or nearly complete. And so voters registration will be moving to that location. And then in the meantime, the current voters registration area, seen here in yellow, is going to be remodeled. And the coroner's office and Veterans Affairs are moving to that space. And And then the health department and the large conference room will occupy this whole area here. So this is the new proposed health department location. So as you can see, the large conference room is moving. So like from back here to here is just moving up. And its two doors will be on this front side here. And then the health department will occupy the whole space around here. So the exam rooms are pretty much in the same location. We're gaining an additional exam room. Our care coordinator office will be right here at the front, opening into the health department. As you can see, our offices along the back, foods and environmental over here. We have a large workroom, mail room kind of in the middle to be shared by everyone. Our own small conference room. And then each division will have their own service window. So here will be the nursing service window, vital records, and then the foods and environmental service window will be out of this area.
That's nice.
So we are very excited. And then this is what will be in the current voters registration area. So the coroner's office, the veteran services office are going to get a lot more square footage than they currently have as well. So it's really a great opportunity for everyone. And so here's just where they went through the budget for remodeling the existing voters registration area for Corners of Veterans Affairs, and then the existing 3 areas for ours. And then this just kind of gives the soft costs of the construction costs, and then the soft costs, the contingencies and permitting and everything in there. And then this is the funding for it. So after they completed the work at 157 Franklin, this is what was left from our ARPA funds. This is the 10% that we were able to set aside for capital for 2024. This is the 10% that we set aside for capital for 2025. And then these are monies that we had put into the budget for furnitures and fixtures. So we'll be able to utilize that money as well. And as the architect said, we did not talk like ahead at all as far as monies. They had given us theirs, and we went through and did the calculations, and that was where we were. So, and then this is the phasing of the project. So as you can see, they're hoping to bid it out this spring. Well, they're hoping to bid it out starting design and then bid in the spring, and then they're going to do the construction in 3 different phases. Okay, so phase 1, they're going to do the existing voters for Veteran Services and Coroner's Office first. And then the 2 different stages for the health department. This is phase 2 and this is phase 3. And this is flexible. So now that we have a plan, we have to figure out what works best in our schedule.
Yeah.
Right now, the phase 2, so the first phase of the health department is set to begin in September of 2024. That falls during our busiest time. So we just have to discuss, is that how that will work and what our contingencies going to be, but we're excited.
Very good.
So if anybody has any questions about that.
Very exciting.
Eric,
Yes.
is the large conference room gonna be large enough for us to convene health board meetings in?
It will be the same size it is right now. That, it's not that room 102A is not gonna be any larger down there.
I just was hoping we weren't gonna have to go big, borrow, and
Yeah.
sign up and steal.
Oh, so that is not, that conference room is not the health department's. It's remaining the whole county as it is now. So we still would have to sign up for that.
Very good.
And then I was just going to give a quick update. So we gave a Health First Indiana update last month, and we talked about hiring and interviewing for the care coordinator, and we have hired someone. So we are very excited. She will begin with us on December the 4th, and she will be at the meeting on December the 5th for us to introduce you. And because she currently is giving notice and things like that, finishing up with her previous employer, we will make introductions at that time. But we are very excited to also just wanted to share with you the latest update I got from the Pierce Group. She said that they are wrapping up this week. As of the beginning of last week, they were at 30 interviews with over 60 participants. And she was asking us to gather some metrics, so as far as comparing statistics for Porter County to Indiana to the United States, which Sam, our intern, was able to pull together and send as part of their report. And we also have been talking with, they were able to get in touch, the Pierce Group, with about half of the school superintendents. And so we've been meeting with the other half just to make sure that, you know, we're talking with all of the schools and getting any barriers, gaps, ideas they may have, you know, for partnerships and things like that. And so that's kind of where we are at with that, and we are looking forward to hearing the report at the December meeting. I did kind of want to, so in the meantime, as we've been talking to everybody, you know, we've kind of put together the Porter County scorecard, along with, you know, the ideas of what it means to be healthy and to live our healthiest life, kind of partners that we're thinking of meeting with, and just kind of give you an idea. This is just, we call this the big idea. There we just have pages and pages of, you know, ideas that we have as far as partnerships. I don't know if it's highlighting, I thought I got rid of it, I apologize. And things that we plan to do. So we'll be taking that.
You have a
and
lot
the
of
needs
plans.
assessment, and all of our different core services in the areas where we're gonna start prioritizing those and just deciding where we're gonna go from there, so. Any questions on that?
I just want to comment, the community outreach you've done since our last meeting has just been amazing. You know, the mobile health unit, the cardiac screens, it's really impressive. Proud of you guys.
We did send a success story to the state about the cardiac screenings, and we heard back from them right away. They haven't posted it on the website yet, but they did contact us and wanted to get more information about that and see how we can take that statewide.
Yeah, because I haven't seen much of that anywhere else. I mean, not that I see everything that the state does, but I thought that was pretty significant that we are headlining that.
We have incredible staff with incredible passion in different areas, and we just are really fortunate to.
We are, and so is the community.
John was going to come up and just give a little update about something that we're doing tomorrow with the health department.
Hello. So tomorrow, we're doing a medical countermeasure for radiological. We live within the ingestion pathway for Cook Nuclear Plant, and so as one of the deliverables, we have to do a notification, activation, and assembly. That just means we all just have to assemble at one location. However, we're taking it a step further. We're actually going to do dispensing as well as demobilization. Indiana Department of Health will be here to evaluate us and how we do with our exercise, as well as the Homeland Security's radiological division. So the idea is that we'll be giving countermeasures to basically stop the uptake of the radioactive material to the thyroid gland, which will prevent cancer. So we'll have a number of agencies assisting us, and we hope to give you a good scorecard when I come back.
Very nice.
Any questions? Okay. Thank you.
Thank you.
All right, so I have a few things for my report today. First, I also want to welcome Dr. Brunt. Thank you for joining our board. We appreciate you and your expertise here. I'm also very excited about the care coordinator position. We interviewed some really fantastic applicants, and I think we got a top-notch one who's very dedicated to Porter County and think she'll do great things for our health department. Another thing I wanted to mention to you is last month, Dr. Boxham and I took a field trip. We went
been a while.
to we went to Tippecanoe County and met with the health officer and the health department there. You might know Tippecanoe County has about 10,000 more residents than Porter County does. They are doing some very ambitious things with their health department. It was impressive what they did there. It highlighted some things. One of the things that was, I think, very helpful that we should definitely look into is part of their health department, one of their programs, or a couple of their programs, were developed into a 501c3. So they could receive donations, tax-deductible donations. At least it makes it much easier to do that. They found that they were able then to receive donations for things like food and donations for things from businesses and such that corporate could write it off, and then they could use it for their programs and services. So I thought that was an interesting concept, and something that I think it would be worth looking into, especially depending on how our programming and our needs assessment comes out. So it also kind of highlighted really the whole point of the Health First Indiana funding being having local decision-making on programming, because it really was evident that Tippecanoe County and Porter County are kind of different places. And they have different demographics and different problems and different population centers, and it was kind of interesting. So they emphasize different things through their health department too than maybe we will find with our community needs assessment. So that was it was interesting to see. It was enlightening, and it reinforced the notion that we need to do what's best for Porter County. So we will be, and not one size fits all in terms of services and programs. So that was a very, that was a really interesting time, helpful information. So this month also I have been working with our Vital Records division. Again, I mentioned this a little bit last month with the fetal death records. So we went back this month and looked at our other death statistics over the past 5 years, and we were able to break things down a little bit to help get, the idea is to help get some clarity or find trends. And we'll go ahead and look at some of these that we have. The first few slides are our accidental deaths. So the natural causes are taken out of here. And in Porter County, over the past 5 years, it's pretty consistently drug-related deaths have been the main cause of accidental deaths in Porter County, followed by traffic deaths. And then with smaller numbers of falls, drownings, co-sleeping, those kind of things. Next slide. Now, we looked at suicides also and the causes of injury, and in Porter County, the most common cause of suicide is gunshot, followed by hanging, and then a smattering of others. I thought it would be interesting to look at suicides by range. Was this by age range? Was this happening in one age demographic versus another? And really, it is all across the spectrum. That surprised me a little bit. What was interesting, and I think actually as we're looking at data for Indiana, is an outlier for us in Porter County, is that it was so overwhelmingly male by gender. So what we did, Carrie just recently listened to a school webinar by the State Department of Health, and they addressed this issue a little bit for young people, and it was that in their data, the gender breakdown was different. So it was much more closer to 50-50 for male and female. So I'm gonna have our vital records clerk pull out the 10 to 25-year-olds and see where that falls also, so that we have that information. The next slide. I thought it'd be interesting to see, are we looking at a problem in the winter? I was actually surprised to find we are not really looking at a problem in the winter. Suicides in Porter County happen every month of the year, and really it's not consistent year to year what month suicides occur in. Now, looking at our natural deaths, so this has taken all the accidents, all the accidental deaths out, and it also removes, if you look at your, you may not have it in front of you, but if you look at your summary that you get from the Vital Records people each month, it will have a section that is pending. So those are coroner cases, and in the past, we really haven't had the ability to go back each month and rectify those. So the coroner will determine a cause that will get closed out over a month or two, whatever it takes to determine the cause. But then it just, in our records in the past, it's just added up. So, so we're figuring out a way, I'm jumping ahead of myself because this is what's not on this slide, but those pending deaths, we're working out a way to incorporate them back into our data to make sure that it is, that all the deaths are counted as accurate deaths and given a proper cause. So back to our slide, the natural deaths, as you can see, they've been pretty consistent. The years 2021 and 22 have been a little higher. This year seems to be right on track to be about where we were in before COVID. So the next slide. So I pulled out some common causes of death, and as you, in Porter County, heart disease, as it is in Indiana, is our #1 cause of death by really a lot. And then followed by cancers, carcinomas. And then one that did not make this list, we have a category for Alzheimer's disease and dementia, and that actually falls just above pulmonary disease. It did not make this slide. And then pulmonary disease and cerebral disease. And then the next slide kind of gives an idea as to where, what proportion of our deaths each of those diagnoses or those categories form. So, you know, heart disease, of course, has the greatest proportion, as I said, and that's somewhere, it runs somewhere between 1/4 and 1/3 of our deaths per year, almost up to 1/2 some years. So that, I thought that'd be helpful to kind of break down our information. We are going to do, I would like to do something a little bit different next year. I think our categories that we report monthly can be changed and to be more useful. So there is a way to make the categories align with ICD-10 medical codes and the overarching categories within those. So they would be transferable to and comparable to other counties, to the nation, those kind of things. They would be very similar. For instance, instead of heart disease, you would have the circulatory system. And under the circulatory system, that would fall heart disease, cerebrovascular disease, so strokes, and venous and arterial diseases. And then we could break those down a little bit more too. So I was thinking we would have for each death certificate we would have it under a category, like a primary category, and then a secondary category, all based on these. And then we could add just a free form other category to add those that don't fit that. For instance, if we had pneumonia, that falls under infectious and parasitic diseases. And then the secondary category could be pulmonary disease, or actually respiratory. I think respiratory system is what that falls under. So it would break our categories down, I think, to be a little bit more useful, and honestly a little bit more accurate.
I think that's helpful. I mean, there's a big difference between a COPD loss versus a pulmonary embolism loss.
Absolutely.
And they all fall into the same category right now, but they would have totally different metrics in terms of intervention. So.
Exactly. Here's the other thing that kind of has made our data a little fuzzier in the past, is that our vital records people are making these decisions. So they don't have a coding or medical background or medical terminology background. It's kind of when they're trained, this is what you do, chuk. So if it doesn't fit exactly, they just do their best guess or other, in which case that's not, as helpful for determining cause of death and for our data. So, so our plan is, starting the beginning of the year, say weekly, the incoming deaths will be reviewed with one of the nurses, and then they will help to someone with a medical background or me. They will help to categorize them further. So that's our plan for moving forward and making our vital records data more applicable, more something we can respond to, and to recognize trends then
With more specificity, we'll be able to do that better.
Yeah, plus it will help with people realizing ahead of time if these are where we're having issues, to prevention care.
Exactly. And we are certainly open to any suggestions you have along those lines in terms of categories that would be helpful to break out. I mean, right now we have it broken out by the town they lived in, the township they live in, we can break it out by anything that's on the death certificate. So level of education, the type of facility they passed away in. So there's a lot of data that we can extract from this. Tobacco, whether tobacco was a factor, those kind of things. So and then race and ethnicity, we can extract that from there too.
Dr. Stamp, you're a physician as well. I've had a lot of interaction with signing death certificates, and I will tell you that from the Drive perspective, they've updated it recently. But even as a physician, I often get death certificates on patients that I don't even know why they died, if that makes sense.
100%.
We're left guessing
Yes.
on that death certificate. So I can tell you that probably 50% of my death certificates I sign are inaccurate, just from my
Well,
Or our
person.
best
And-
guess.
Or best guess, yeah.
Right,
Yeah.
or uncertain.
Right, uncertain,
Yes.
right, and
Yeah.
there's no category for us to be able to list that, because the system forces you to put something
Yes.
in even when you don't know what the cause was, which is a
Correct.
huge issue.
Which
She
is
gets
a
stuck
lot
with
of
the
what
ones
I-
that none of them. She's stuck with the ones
Right.
that none
It's
of us
a lot of
can
what
do.
I deal with,
Right.
right?
Yeah.
Is physicians in the community that when they have a patient they haven't seen in 6 months,
Right.
maybe
Even longer
For me, it's a year that I put the
try
cutoff.
not to require
Or I get them
physicians
sometimes
who
it's been
haven't
5
seen
years.
their
Yeah.
patients in a year or more
Yeah,
to
yeah.
sign a
Right.
death certificate. But a lot of times it doesn't come to me because the coroners deal
Right.
with that also, especially if they
And-
if they died outside of a medical facility, we don't have any information on them.
Right, and
The coroner goes out, they talk to whoever else lives in the home, they talk to any family, they gather the medications, they get a best guess as to, well, this doesn't seem like it's foul play or a non-natural death. And then they generally, there are very few that they actually send to autopsy.
yeah,
So we, as physicians in the community, It is a difficult job.
We struggle.
Right.
But it is, we have to use the best information we have at hand to do that certification. And so when really doctors in the community cannot, then it falls to me to be the certifier of that, and I just gather whatever information I can from the coroner or the hospital or wherever they might have been treated.
If, you know, just as a suggestion, maybe we can reach out to the coroner's office. It would actually be nice, the pressure comes in from A, the family, and B, the funeral home to get the system rolling. Maybe there's a way that we can have the coroner's office potentially involve the physician that's going to sign that to at least give us some background, because a lot of times I don't even know where to look to get the
Have you
information.
been called? Like, I've had the coroner's office.
They never
call
called me.
You've been
They-
called. Yeah, I've been called. Yeah.
They rarely
Yeah.
call me.
Yeah.
Yeah.
They should do that, I think,
Yeah.
more as part of
And
the
they were very
investigation.
Right.
comfortable doing that.
Especially if
Yeah.
you don't
It's
know
just a
the
matter of organizing
underlying
it and
Right.
situation.
It's hard.
Right.
Yeah, I am hoping in the future, so as part of this Health First Indiana funding and data collection and those kind of things, to work more closely with the coroner.
Beautiful.
Yeah, that is
And the
really a
funeral
goal of
homes.
mine.
She said it was a matter of finding the time and or the accessibility to do it. So that's where if you
But-
have a little better management flow or ability to do it, it would just make it easier.
I mean,
And
if they're generating a report anyhow, it would be nice to have access to that. So,
Absolutely, that's a great suggestion, thank you. Otherwise, that's really all I have, so, for today. Do you have any questions for me? I'm happy to answer.
No, I love this. Like, the nerd in me really, especially this last one, the
May I
percentage of
ask,
things.
on slide 5, this is suicide by month. Did you break that out by gender or age to look for trends?
We
per
have
month?
not at this point, but we
Okay.
certainly could, specifically the month one by gender and age.
Only because that way we could see if there's trends, especially, around like really sort of hot topic times.
Like, I've heard like back to school.
Yes,
Like
that's-
the back to school month is always a hard time when the
And-
kids go back for
right.
the young people. But I don't know if that matches our data,
That's
but.
what I was wondering
Yeah.
specifically. And
Really?
also-
Okay.
Yeah.
Yeah,
because that's
usually
my
holidays,
experience, and
Yeah.
so that's
keeping
why I'd
during-
like to see a breakout of that data based on gender and age, just to see, is there
Sure,
a trend that we're
absolutely.
seeing?
Yeah, I mean, if you
Yeah.
look at September
Yeah.
and just add up every one for it's a fairly, August, September, is a fairly high month.
And it'd be
High
interesting
months.
to see like obviously there's outliers there, but, I'm sort of the same.
I know.
Yeah.
When we're
Yeah.
in the bar.
Yeah.
Look at data, so.
I will do that for you,
Another-
we'll see what we find.
You know, January, it's like the new year. That's
Any
not-
other committee?
not the new year.
No. You're good? Okay. Thank you. Are any miscellaneous add-ons?
Oh,
Okay.
Yeah.
So at this
Me-
time, we
that's-
will open up the floor to public comment. I don't want to read it all out to you, but we're going to limit it again as usual for 3 minutes per individual. Sign in for us and go with that. Public comment? No? I got all excited.
I can tell you my name that I tap dance, but that's okay.
Thank you, thank you.
Got one, hang on. Tap dance.
Thank you. It's like having no trick-or-treaters. That's disappointing. Don't worry.
Well, it's past everyone's bedtime now. It's dark out.
Hello, everybody. Test. Are we on? I just want to say I haven't. These last few years is the first time I've been coming to these meetings. They're actually really, really, really boring, but it's not your fault. I'm just here to provide some entertainment. I would like to say, last 3 years have been very, very strange. weird things happening. At this point, I've never took a PCR test. I do wear a mask every now and again, just to, be safe. And I've never been vaccinated. Healthy as can be. God is good. Does anybody know what the most washed body part was in 2020? Does anybody out here want to take a guess? The most washed body part?
Face.
Your face. Nope. Most people say your hands because you got to wash your hands and all that stuff, but actually the most washed body part was the brain. I just want to read a few verses. We have a lot of physicians here. Luke chapter 8. And again, all the answers for today are in the Bible. I would strongly encourage you to pick one up and read it. Luke chapter 8, verse 43, and a woman, that's a confusing topic today, what is a woman? And a woman having an issue of blood 12 years, which had spent all her living upon physicians, neither could be healed of any, came behind him, referring to Jesus, and touched the border of his garment, and immediately her issue of blood stanched. Now, I can't go around touching people and healing people, but we have a lot of cures, and it's not through the medical industry. It's not through Big Pharma. Big Pharma actually poisons people. And now I just want to close with another riddle or another joke. A couple years ago, we were mandated to do different things by the government. Okay, mandate isn't a law. And just look at the word mandate. It's two words, man and a date. So what is a mandate? It's when two dudes go out on a date together. That's a mandate. For instance, Barack Obama and Big Mike, Michelle. That's a mandate.
Just have a quick question. The health department was allocated $1 million for the renovation, correct? From ARPA. Now the project came in at about 1.4 million. Where is the rest of that money coming from? Who's funding the rest of that?
So the 1.45 million, go back and look, is for not just the renovation of the health department, that's for the renovation for the move for voters.
Okay.
That's also for the move for veterans and for the coroners. So it includes, it's 4 offices that are moving, so that's the 1.4 million. The 1 million was for the ARPA funds, and then the Health First Indiana funding, 10% every year can be set aside for capital projects or improvement. And so that's what we're doing for 2024 and 2025. And that will effectively cover the cost.
So is that part of the SB4 money?
Yes.
Sorry, I know it changed like 5 different names.
Yes, that's right,
Correct.
yeah.
So it is, okay, so that helps with the remainder of that funding. Okay, that's all I want to know, thank you.
All right, can we have a motion to adjourn? No. Oh, you're coming? Okay, sorry, Mrs. Silver.
I was just seeing who else.
That's all right.
Just gonna pass these, you know what, take one and pass the rest down.
Hi, Deb Silvert. I signed in at the back. This you're getting a copy of this. I gave it out last time. I have extra copies. When it gets down to Carrie Geschwind, I would like everybody else to have a copy of this as well. There's another document that I had previously emailed to Board of Health members, I think even the commissioners. It was a 19-page long document, but I made it small. I made it just 4 pages. I just excerpted things from it that were particularly relevant. So I love the timer. Thank you. The mission of the Health Department is to promote and protect the health and well-being of our community, Porter County. I want to back up and take a 40,000-foot view. We're living in some really unprecedented times, and I just want to have moral clarity about what we're doing. I think particularly me, I've been adversarial. Perhaps in the past, I don't want that to continue. I don't think that needs to continue, and it really wasn't necessarily my intent. I was just very frustrated, and not to apologize for that. It was what it was. Perhaps I was overly blunt, et cetera, but I want to commend Dr. Stamp, especially for that huge slideshow that you put together for the last time Board of Health, and also this one, extremely helpful. Can we get those posted on the website? Oh, they are? Okay. That.
With the minutes of the meeting.
Fantastic. I think that's just great. Okay. One of my things that I didn't really, big issue, I don't understand the inner workings of the health board. And I wasn't convinced since I became involved back in June that we had a working board. You know, like I've been on boards, I have a board, I have a nonprofit. You know, there are working boards and then there are just boards that just kind of sit. So I just wasn't really sure about that. And I filed a Freedom of Information Act records request with you all to see emails and so on of what was going on behind the scenes, because I was having a hard time believing that all the health board business was being conducted in one meeting a month, like the board business. I couldn't, I was like, what how is this happening? So we're a little over time on that. Attorney Hollenbeck was good keeping in touch with me on his progress. He's the person in charge of getting those records. But we're 16 days out of now, beyond the latest, most generous timeline on it. I haven't heard from you since October 20th, I think, or maybe the week after, October 27th. So like to know how that's coming. I really feel like such an outsider trying to get a picture of what's going on inside. I really want to see the health board's autonomy demonstrated or tested. I really think if this board is autonomous, there should be more investigation done into some of the things that citizens have presented and research and so on. This document is just startling. People really need to look at that. The Vaccine Adverse Effect Reporting Service, there were 2,500 adverse reports from vaccines, of side effects from 1990 until the COVID vaccine rolled out. Now there are 1.5 million. Where did all of those side effects, this is just, it's crazy. And there's a chart on the back if you want it visually that way. This is something that needs to be looked into.
Thank you, Ms. Silver.
Okay, last comment. There is the WHO deadline coming up the end of November. That's what the other document is about. I'd love to see the board take a position on this and write a letter. And then, you are our public servants, right? And the public is concerned, and we want to work with you. I think we could do a lot if individual board members would partner up with individual people in the community. We could get some things done.
Thank you. Motion to adjourn? Huh? Oh, yeah. Well, you changed your mind.
It's
Your prerogative.
I just want to say thank you to the board for allowing public input. They actually do have public input and pretty much can speak pretty much their minds. And I'd just like to say thank you for allowing everyone to do that. While we don't always agree on everything, and I mean the public, the board, myself even, I'd like to say that each of you who spoke today, remember that when you're up here. You were given that time, and to treat that time respectfully if you'd be so kind. That's all I got to say. Thank you.
Thank you, Councilman.
Hi, everybody.
Hello.
Welcome to the new members, too, whoever they are. I'm not right sure. But anyway, I just wanted to just make a comment and then hand out just this one thing. I don't have that many copies. My printer kind of broke. But my whole point, and when I, have been coming up to you guys for the last 6 months, was not to argue with you or like make you, to say you guys are doing everything wrong. If that was what came across, I'm sorry, that's not my intention. Okay? My intention, honest to God, is I wanted to challenge you to do your own research outside of the CDC and the FDA and Pfizer, because they're lying to us. They're still lying to us, and they have been lying to us. And there's so much evidence. Dr. Dr. Stamp, when you did your really nice presentation last time, I noticed that everything was quoted from FDA, CDC sources. That's the part that's bothering me, is just that I would like to see more scope in like getting other doctors' opinions as well worldwide. They're out there. It's all over the place, like Deborah said, with all the injuries. Okay, so what I have here today is just something this is from Dr. James Thorpe. Dr. Stamp, you know who he is. He's an OBGYN specialist who sees thousands of patients every month. He put out this, actually a challenge to physicians, which I'm going to send you guys, but it's on Rumble, but it's really a doctor, okay? And so anyway, this is something that he wrote that I just found on his site today. He says, this is, when I stress it's where he has capital, this is the greatest disaster in the history of obstetrics and of all medicine. I testify that this unwarranted experimental gene therapy was never indicated in pregnancy and was perpetuated unlawfully and with falsified data. The facts speak for themselves. It was known by Shodlik, I might be saying that wrong, as early as 2012 that lipid nanoparticles concentrate in the ovaries of mice and Wistar rats. The FOIA request of the Japanese Pfizer biodistribution studies confirmed that within 48 hours, the vaccine was immediately absorbed into the bloodstream and concentrated in the ovaries, 118-fold by 48 hours. And the trajectory would have risen even higher had the animals not been sacrificed at 48 hours. It was incumbent upon the stakeholders to have excluded long-term effects prior to rolling this novel experimental gene therapy out. The long-standing golden rule of pregnancy has never allowed unknown substances to ever be used in pregnancy. And he goes on, I'm just giving you a little bit. He does also have, from VAERS, he's got here all the VAERS reporting on the increase of menstrual abnormalities by 1,192-fold, miscarriage 75-fold, fetal malformation 20-fold, fetal cardiac disease 16-fold, and on here. So I'm going to just give the doctors at least this, and I'll send this to everybody so that you can take a look. My challenge is just to please look outside of the FDA and the CDC for information, because I know you guys would want that for your families too.
Thank you.
I just want to get the doctors first, because I only have 4.
Yay me. Sorry.
What are we?
Touche.
Although I have a jurist, so I want to be referred to as.
No, anybody else?
I'll buy you a stethoscope.
Yeah, right? We'll share. All right, thank you. We have a motion to adjourn.
Or you can just borrow.
All in favor?
Do you want to get up?
Aye. Thank you all.
You want your 3 minutes? Still have a chance.